Thank you very much, and thank you for being at this debriefing. I think we are now. I was thinking this morning that we're 5 months into this pandemic, and obviously all of us want to know where we are, what we've been, and where things are. I mean, I think that one thing is I think the amount of what has happened in the U.S. has been quite remarkable. I mean, the number of cases we have, the number of deaths we've had, but I think what we're beginning to see in the U.S. is also, I would say, a certain stabilization, a certain plateauing of the number of cases. I think probably one mistake that was done is this idea of thinking that we're going to have a curve and a peak, and then it was going to come down and disappear. I think we have more of a peak and then a plateau. It's almost like we reach a mountain and then we're beginning to stabilize. And I think there's very clear evidence that because of social distancing, because of the shelter in place, the number of cases were not as many as they could have been, and I think the number of deaths were not as many as there could have been. So the doubling time in the U.S., the number of deaths in the U.S. has also kind of stabilized at a certain level. We are at a point, though, however, that we did see as a result of this lockdown and shelter in place, I would say a shutdown of the economy, not only locally in the U.S. but globally. And obviously, this has caused significant economic pain, a lot of unemployment, a lot of problems. And I think obviously now as a nation, we're at the stage of trying to figure out how do you safely reopen while you reactivate the economy. And I think Georgia is essentially in the same situation that I talked. We are seeing in our state I think cases are a little harder to follow up in our state now and in the country as well, because as more testing is being done, as we conduct more testing, you are going to find more cases. And I think you're going to find a lot of more, not necessarily symptomatic, right, but more asymptomatic cases. I think it's important to track number of deaths. I think it's important to track number of hospitalizations. I think it's important to track ICU capacity. And I think really it's important to realize that who's getting infected and rapidly. I think the key as a state level and as a nation is to rapidly identify individuals, isolate them, do contact tracing, and stop the outbreaks. I think we're going to see little outbreaks, but the idea is to make sure that those outbreaks don't become large outbreaks, that we can contain them so you can actually limit the spread of infection. Because obviously, as you're opening up the economy, you will have cases. There's no doubt about that. So that's what I would say, Susan.
I think we definitely find ourselves at a place where we have gone down on cases, but we are reopening the state. And so that's going to create a number of challenges that I think we need to keep reinforcing as we go through the summer. We look to the fall to when there could be potentially school and colleges and universities opening. And I think we see that we hope to be ready from the testing standpoint, from a serology standpoint, and from a transmission standpoint, with also maybe some more knowledge about both therapeutics and at least additional knowledge about the vaccine by the fall. I think one of the things to focus on that I'm sensing that we're going to pivot to is our personal responsibility on that in everyday life, right? As we sort of have people that are getting back together. So remembering our sources of truth, right? So cdc.gov is a source of truth in terms of behavior, prevention of spread. And also the DPH website is very good local contextual knowledge about what's going on in the state of Georgia. I think that we had a very busy Memorial Day weekend over the United States, and I think that people need to still be using their own determination of what their quarantine is. And so the way that I've been answering questions for friends and colleagues is, how big do you want your coronavirus circle if you have a decision to do that? So obviously your employer and where you live should be using protective measures. I know that our healthcare workers feel safe when they're at work, but again, we need to sort of be bringing that into the community about people that are medically vulnerable, that may be around people that may be asymptomatic spreaders, such as children. All of those sort of things need to be considered as we reopen the state. And so while some people may have a comfort level to be able to move about and do things with less restrictions, I think there's still individuals that need to be concerned about their fragility, about their likelihood to do poorly should they contract this disease. And again, one of the reasons that we did social distancing and we closed down the curve is so that we don't overwhelm our healthcare systems. And so I think that it's still really important that we continue to protect those that could be at risk until we do have, very rapid testing, for instance, a sure vaccine and very good therapeutics.
Our first question I'm going to direct to Dr. Kraft. Should all medical personnel wear masks in doctor's office, urgent care clinics, and hospitals? How about restaurant workers?
Yeah, so we've come full circle on this. Initially, we thought that there may not be a necessarily change to the spread of the transmission with a mask, but we really feel like now that there is an aspect of protection and an aspect of a reminder of social distancing when you are wearing a mask. So we do recommend that individuals wear masks. At Emory Healthcare and other places, this is not a mandatory thing, so it is not enforced. However, I think it's highly recommended that we use masks to protect ourselves. So my mask protects me and protects myself. And so that's sort of how we've been looking at universal masking. It's a pretty small intervention that I think has a lot of yield in this way.
And I think, if I may add to that, is that also by wearing a mask, it really becomes also a reminder of doing other things, like, for example, social distancing. It just acts as almost a visual reminder that, yes, still something is going on. And I think one of the things that I worry about is people tend to, since you don't see the virus, you tend to think that it's no longer here. And I think it's just a way of reminding ourselves that, yes, this virus is still here, it hasn't gone away, and I need to do something about it.
Have we figured out whether the 20% jump here is a real surge or a quirk of how labs report?
I think it's a combination of both. I think there is clearly, as I said, there's more testing. We know that there was a lab that had a lot of test backlog and they sort of all of a sudden dumped them. But again, if you look at the date of onset of symptoms and the day of testing, that may adjust the curve. I think that we are seeing also an increase. I mean, it's not surprising that as we are opening, you're going to see more cases. So I think a combination of both is not either or. I think it's probably both.
The city of Atlanta is still recommending that all people shelter in place and recommends against dining in restaurants. That differs from the state's guidance. Which do you all recommend for people who are confused about who to listen to?
Well, I listen to myself and I listen to the data. And as Dr. Kraft said, I look at data to inform myself. And, the data tells me that I should probably continue sheltering in place. So I'm not ready to go to a restaurant yet. I am still ordering out. I'm still eating at home. And I think, again, you realize that it's not policy, but it's really individual decision-making that is going to make a difference. And you as an individual need to look at the data. And the data, in my mind, does not convince me that I'm ready to go and eat at a restaurant close to somebody else.
Great, let's continue to Dr. Kraft. Building on Ariel's question, do we have a sense of how Georgia's reopening affected cases yet?
We won't. So I think the reopening has been quite kind of a little bit stuttering. So although the state had reopened and loosened some of the regulations, I think the behavior of most of the individuals of the state still was some apprehension to returning to normal activities. But I think that we'll know a lot more in the next month, given the quite busy Memorial Day weekend and sort of the dynamic of travel that I think is starting to occur. And so I don't think we yet know the implications of sort of being together and people doing their activities together yet, but we will within the next month.
All right, next question. Rio, is it people getting antibody tests when we hear half of the tests are inaccurate?
Well, I think I'll let Dr. Kraft talk about the test being inaccurate. I think there's a lot of tests out there, and I think I would be very careful saying all tests are inaccurate. I think, a lot of tests are very accurate. It's just an issue of which test you're doing and what exactly you're using the test for. I think, there's also something related to what the test exactly means. So I think an antibody test, in my mind, at this point in time, I'm not necessarily thinking that I'm ready for prime time to recommend it to people. I think it's still something we're trying to understand where it fits, how we're going to use it. I think it's being used in public health to get an idea of how extensive this disease has been, but I think it's not something that I'm ready to use at an individual level. I have used it a few times at an individual level. Let's say, and again, I haven't discussed this with Dr. Kraft, but here at Grady, let's say somebody tests negative on their PCR test, but it's in the ICU, it's sick. We really think this person may have COVID. I may get an antibody test just to see, how can I combine that with a PCR test, but it's not something that I would routinely recommend people do for the diagnosis.
I also think, just to add to that, I think that we need to wait and make sure that we're using the best and most diagnostically accurate tests. As Dr. Del Rio already mentioned, I think there's a public health aspect to trying to see, what our herd immunity or what the total immunity could be. But I think that, we've only been really using it at Emory for individuals that were sick in February, that we're trying to figure out if retrospectively they actually had COVID-19, and therefore we were seeing it earlier in the state than we realized. And then we're also using it for some healthcare workers survey to make sure that we're doing the best job we possibly can. The test at Emory Hospital has been developed by the Emory Vaccine Center, and we have a lot of confidence in its ability to be sensitive and specific. So I would just say that if individuals want to be tested by a test that we know a lot about the test characteristics and how it works in people that have confirmed virus, that they should wait till the end of June or early July until we have an automated platform and we can be able to serve the public. That's, again, maybe a little bit of a bias, but I know the most about our test that was developed here.
Great, thank you, Dr. Kraft. Dr. Del Rio, is it safe to assume that we will see an increase in cases in the next 2 weeks, given the Memorial Day weekend and the number of people who left their homes to gather in large groups?
I think it's safe to say that we're going to have to continue to increase cases in the U.S., whether it's Memorial Day weekend or it's just the fact that, again, we are reopening, we're lifting restrictions. And I think it's really going to be a matter of, again, I go back to what Dr. Kraft said, it's going to be what the individual choices are. That if you have a lot of people out there with a lot of contacts, you're going to see a lot of cases. If you have less people with less contacts, you're going to have less number of cases. So I really think it's going to be a lot about individual behaviors and less about, policies.
And I really think that people need to think about their coronavirus circle. So if they're prepared to have the exposures of many other people affect their family or their individual, that's really how they need to be making decisions. So I've had people ask me about whether they should send their child to camp, and asking them back to say, do you want to have the exposures of the other 20 to 40 children that are going to be there? Do you want their circles to be your circle? And if the answer is no, then consider not sending your child to camp. However, if you do feel like it's time for you to have a broader coronavirus circle and a broader exposure risk, then I think that that's sort of part of how you make the decision. I think the best thing to do, and Dr. Del Rio alluded to this, is to just figure out what makes you comfortable and where your risk is. If you are medically fragile, keeping your coronavirus circle or your quarantine very small is really important for your health and your risk. But also making sure that other people in your coronavirus circle actually want to be in your coronavirus circle. So as I've said before, there are people that we interact with and our children play with that we know have very similar scenarios and similar philosophy about how they want to keep themselves safe. And I think that's really important as we sort of navigate these uncharted waters.
Hey, Dr. Kraft, some children have had a severe inflammatory syndrome. What are we seeing in Georgia in terms of this unusual COVID response?
This is in general a pretty rare disease. And so I think we're going to learn a lot about the way that this coronavirus affects our immune system. And unfortunately, it is most pronounced in children. It manifests itself in the same way in adults, but it looks really just more like sepsis, which is something that we're really used to dealing with in adults. But I think that, we've not had an overabundance of these types of illnesses in children yet in Georgia. But again, it's because it's really a rare disease.
Great. Let's move on to the next question. This is 3 parts. Let's start with Dr. Del Rio. Dr. Del Rio, do you think that the way DPH is counting cases and assigning cases to the first day of symptoms is valid? How about useful?
You know, I think it's better than counting cases on the day that the cases, the reporting is received by the state. I think, you know, sometimes determining the onset of symptoms is hard. I think the simplest way, and I was talking to some people at CDC, is obviously by the date of test, because knowing the date of test is probably the one that is more useful. But this has been an ongoing debate in many diseases. In HIV, we have said, well, do you look at the cases by the day of diagnosis? Do you look at it by the day of onset of symptoms? How exactly do you graph them? I think it doesn't really matter that much as long as you are consistent in the way you're doing it and you're pretty clear on what the limitations are. This is a disease that the difference between onset of symptoms and testing is very close. It's about, you know, 3 to 5 days. So it's not a huge amount of time. It's not like when HIV, where the time where you got infected to when you get tested or develop symptoms may be several years. This is very different. So it doesn't make that much of a difference, quite frankly.
All right, Dr. Kraft, what would be enough testing to catch a resurgence look like? Can you give us some examples of where people would be tested and how often they might need to be tested?
Right, so I think that when we talk about sort of the future state of testing and kind of finding these pockets of resurgence, we think about basically being able to do this at an urgent care or any sort of walk-in clinic and be able to get the results at least same day or next day. And I think that we would also focus very much on people that are having symptoms. So while there have been some testing, and we do this at Emory Healthcare, that we test all of our patients as they're admitted, just to find those cases that are asymptomatic, that's a little bit of an unusual scenario. What we're trying to do is make sure that our healthcare workers and other patients are not being exposed to people that are not having symptoms. However, in the general public, I think that being able to get a very rapid but diagnostically accurate test will be very helpful to us in the future. And when we think about reopening schools and having places where we have to congregate and we don't really have a lot of choices, this will really help us in managing those populations. And so I think we're getting there. We're not quite there yet. A lot of it has to do with supply chain and ramping up this manufacturing, as well as just figuring out how that testing occurs and how that's balanced with other testing in the healthcare system.
And I think that from a public health standpoint, we look at, again, if a state is doing about 30 tests per 1,000 population, they're doing pretty good. And that's, and again, I recommend people look at there's a website called COVID Exit Strategy, and it's a good website to look at and see where are we as a state in testing and in other things. And if you look at that, you know, somebody was looking at data. If you look at that site, Georgia, that used to be yellow, is now red, and is now red because cases are going up.
Okay, next question. The next question is referencing a recently released report against opposing the widely reported recommendations to remain 6 feet apart. And you can see the details there, Dr. Del. Is 6 feet of distance enough given the continued report about aerosolized transmission? Well,
again, I go back to what Dr. Kraft said, is 6 feet, and I read that paper by Dr. Schooley, and that just came out in Science yesterday. They're actually making the argument for masking. They're saying 6 feet apart is not enough. You need to wear a mask. And I couldn't agree with that more. And again, I think it's not 6 feet apart or mask. It's a combination of both. You really need to think about, you know, if I truly want to decrease my risk, I'm going to stay 6 feet apart and I'm going to wear a mask.
Yeah, the bottom line is really about our behavior and how our behavior affects the transmission of this virus to other people. So it's really, you know, we try to simplify it to say six feet apart. We try to simplify it to say masking. But the bottom line is these are things we should have been doing every flu season, is hand hygiene, face hygiene, cleaning dirty surfaces, and not touching things and bringing our hands to our face, as is sort of alluded to in the face hygiene. And so, you know, we can tussle over the details, but the bottom line is you need to be aware of keeping yourself safe and other people safe. And if you have less interest in keeping yourself safe or following these types of rules, Again, we're in a country of personal choices, but you need to just be sure that you're being respectful to other people and their medical fragility.
And I would say somebody mentioned there that, most people are not epidemiologists, they can't look at data. I would recommend that you look at least here in Atlanta, I think we did a really nice job with the mayor's office. Look at the website, atlantastrong.org, and you can see there, the data dashboards. And I think the data dashboards and what is there as far as testing and other things are actually pretty good for people to look at. And I would recommend people go and look at that information because it's well done. And I think it really provides the kind of data that you need to make decisions.
Great, thank you. Dr. Kraft, because there's not been any major surge following the reopening of Georgia and several other states, do you think that people will not take the potential threat of a second surge seriously?
We're really in uncharted waters right now. I think that we unfortunately are going to have, we cannot keep shutting the economy down. I think that's been very clear. I don't think we can sustain sort of an indefinite shelter in place. So at some point, we're going to have to resume a level of normal activities. Whether or not they take it seriously, I think that we will be seeing probably additional cases, and hopefully with the preparedness that we've done, we can sort of accommodate those in the healthcare system. But I do think that we, it's hard for me to say whether people are taking it seriously or not, because I do think that there's such a push to return to normal activities. But I think we need to be taking personal responsibility on how we protect ourselves and protect those around us.
Yeah, I mean, I couldn't agree more with Dr. Kraft. This is about personal responsibility. This is about me not wanting to become infected. This is about, and I tell people, I do not want to see you in the hospital. I do not want to see you in the ICU. It is not, I mean, this is this could be potentially a bad disease, and you should not try, you should do the best you can not to get it. And I guarantee, people say, well, have you been going to work? I'm coming to work every day, but I take my responsibilities and I have not gotten infected. I know what to do in order not to get infected.
Great, Dr. Del Rio, we're going to be wrapping up here, and Dr. Kraft, Dr. Del Rio, do you have any final thoughts that you'd like to share?
I think my final thought is that this epidemic is not over. This pandemic is not over just because a politician is saying, it's safe to get out, or, we want to reactivate the economy. I think there is important economic decisions that need to be made. And what I would tell people is this epidemic is not over. Take care of yourselves. Practice social distance, be careful. This is not normal times. It will be normal times later. It's not going to be, but it's not right now. And just please be careful. I don't want to see you infected. I don't want to see you become a statistic. Yesterday, we passed over 100,000 deaths in this country. We are currently at a rate of about 1,500 deaths per day in the US. That means that by the end of September, there will be, beginning of September, by Labor Day, there will be another 100,000 deaths in our country. That is a very sobering number. And each one of those individuals is a person, is a family member, is a friend, and don't want to be one of those. You really want to remain healthy. You really want to stay uninfected until we get to the point that we have a vaccine or we have better therapies. And that's going to happen because we have outstanding research happening. And here at Emory and many other places, we're involved in research, we're advancing the science, and science is going to be critical to get us out of this mess. But it's not going to be immediate.
So I think we are going to be entering a very difficult phase of this pandemic, where we have economic sluggishness and we have the need to return to normal activities for those economic reasons, with the concern that we still may be transmitting this disease. So all of that is going to be, again, we're not out of this sort of acute kind of fearful stage. We're now moving into this stage where we're climbing our way out of it, but we're in a plateau, which could easily become a surge. And we have to return to normal activities, and we have to figure out how to keep ourselves safe and those who are medically vulnerable. So I think people need to continue to think about their quarantine and who they interact with, their coronavirus circle, and also how that quarantine can support you, and also how you can keep yourself safe in order to keep your family members safe.